Question 1. Compliance review shows a certified forensic nurse is attending to a patient who has just disclosed a recent sexual assault. The patient is visibly distressed, tearful, and expresses a strong desire to shower and change clothes immediately before any examination takes place. The nurse recognizes the critical importance of preserving potential forensic evidence. What is the most appropriate course of action for the certified forensic nurse? Option A. Suggest the patient shower and change, and then inform them that a forensic examination is no longer possible due to the contamination of evidence. Option B. Gently explain to the patient that showering and changing clothes would compromise crucial forensic evidence and that the examination must be conducted first, while offering immediate comfort measures and reassurance. Option C. Allow the patient to shower and change immediately as requested, prioritizing their immediate comfort and emotional well-being above all else. Option D. Proceed with a full forensic examination without delay, documenting the patient's distress, but not pausing to address their immediate request to shower and change. The correct answer is B. Gently explain to the patient that showering and changing clothes would compromise crucial forensic evidence and that the examination must be conducted first, while offering immediate comfort measures and reassurance. Explanation. This scenario presents a significant ethical and professional challenge for a certified forensic nurse, CFN, due to the inherent conflict between the patient's immediate emotional distress and the legal/forensic requirements of evidence preservation. The CFN must navigate the patient's vulnerability while upholding their duty to collect and document evidence accurately and without contamination, which is paramount in sexual assault cases for potential prosecution. The correct approach prioritizes a patient-centered, trauma-informed methodology that balances immediate care with forensic integrity. This involves establishing trust, explaining procedures clearly, and obtaining informed consent for all examinations and evidence collection. By validating the patient's experience and offering choices within the forensic context, the CFN respects the patient's autonomy and minimizes re-traumatization, aligning with ethical principles of beneficence, non-maleficence, and respect for persons. This approach is supported by professional guidelines for forensic nursing practice, which emphasize patient advocacy and evidence-based care within a legal framework. An incorrect approach that focuses solely on immediate comfort without addressing forensic needs would fail to meet the legal and investigative requirements of a sexual assault examination. This could compromise the integrity of potential evidence, hindering any subsequent legal proceedings, and failing the patient by not providing a comprehensive forensic assessment. Conversely, an approach that rigidly prioritizes evidence collection without adequate patient support and consent would be ethically unsound, potentially causing further harm and violating the patient's rights. This would contravene principles of patient dignity and autonomy, and potentially violate regulations regarding informed consent and patient care standards. Professionals should employ a decision-making framework that begins with immediate patient safety and emotional support, followed by a clear explanation of the forensic examination process, including its purpose and what it entails. Obtaining informed consent is a critical step, ensuring the patient understands and agrees to the procedures. The CFN must then proceed with meticulous evidence collection, documenting all findings and actions accurately, while continuously reassessing the patient's comfort and ability to participate. This iterative process ensures both compassionate care and forensic rigor. Question 2. Market research demonstrates that a significant portion of the population served by a forensic nursing unit identifies with diverse cultural backgrounds, presenting unique communication styles, health beliefs, and family dynamics. A forensic nurse is tasked with assessing a victim of sexual assault who speaks limited English and appears hesitant to make direct eye contact during the initial interview. Which of the following approaches best optimizes the forensic nursing process in this situation? Option A. Employing a qualified medical interpreter to facilitate clear communication and inquiring about the patient's cultural preferences regarding personal space and touch, while observing for nonverbal cues that may indicate discomfort or understanding. Option B. Relying on assumptions about the patient's cultural norms based on their perceived ethnicity and proceeding with a standard protocol without seeking further clarification. Option C. Minimizing interaction with the patient to avoid potential cultural misunderstandings and focusing exclusively on documenting observable injuries. Option D. Proceeding with the assessment using basic English phrases and gestures, assuming the patient will understand and respond appropriately, and focusing solely on obtaining physical evidence. The correct answer is A. Employing a qualified medical interpreter to facilitate clear communication and inquiring about the patient's cultural preferences regarding personal space and touch, while observing for nonverbal cues that may indicate discomfort or understanding. Explanation. This scenario is professionally challenging because forensic nurses are often the first point of contact for individuals who have experienced trauma, and these individuals may come from diverse cultural backgrounds. Failure to recognize and address cultural nuances can lead to misinterpretations of patient behavior, ineffective communication, and a breakdown in trust, ultimately compromising the quality of care and the integrity of the forensic investigation. Careful judgment is required to navigate these complexities while adhering to professional standards and legal mandates. The correct approach represents best professional practice because it prioritizes patient-centered care and upholds the ethical principles of respect, dignity, and non-maleficence, as mandated by professional nursing standards and relevant forensic guidelines. By actively seeking to understand the patient's cultural context, the nurse can tailor their communication and assessment strategies to be culturally sensitive and appropriate. This fosters a therapeutic relationship, enhances data collection accuracy, and ensures that the patient's rights and needs are respected throughout the forensic process. Adherence to these principles is crucial for maintaining professional integrity and ensuring that the forensic evidence gathered is admissible and reliable. An incorrect approach that involves making assumptions based on stereotypes is a significant regulatory and ethical failure. It violates the principle of individualized care and can lead to biased assessments and interventions, potentially causing further harm to the patient. This approach disregards the diversity within cultural groups and fails to recognize each individual as unique. Ethically, it breaches the duty of care and the commitment to providing equitable treatment. Legally, it could lead to accusations of discrimination and malpractice. Another incorrect approach, which is to ignore cultural considerations altogether and proceed with a standardized protocol without adaptation, also represents a regulatory and ethical failure. While standardization is important for consistency, a rigid adherence without cultural sensitivity can alienate patients, impede communication, and result in incomplete or inaccurate data collection. This failure to adapt care to the patient's cultural background can be seen as a breach of the professional obligation to provide competent and compassionate care, potentially impacting the validity of forensic findings. The professional decision-making process for similar situations should involve a commitment to continuous learning and self-reflection regarding cultural competence. When encountering a patient from a different cultural background, the forensic nurse should actively engage in open-ended communication, ask clarifying questions about beliefs and practices relevant to their care, and utilize available resources such as cultural liaisons or interpreters when necessary. The nurse should approach each interaction with humility, recognizing that they may not have all the answers and being willing to learn from the patient. This iterative process of assessment, adaptation, and validation ensures that care is both culturally appropriate and scientifically sound, upholding the highest standards of forensic nursing practice. Question 3. Compliance review shows a forensic nurse is attending to a child victim of suspected abuse. The child is visibly distressed, tearful, and hesitant to speak. The nurse's immediate priority is to establish rapport and ensure the child feels safe, while also recognizing the critical need to preserve potential forensic evidence. Which of the following approaches best balances these competing demands while adhering to legal and ethical standards for forensic nursing practice? Option A. Gently engage the child in conversation about non-threatening topics to build trust, while discreetly observing for any visible injuries or evidence, and preparing the examination room for a forensic assessment without immediately initiating invasive procedures. Option B. Proceed with a full forensic examination as quickly as possible, documenting all findings meticulously, and then inform the child and their guardian about the importance of the evidence collected. Option C. Focus entirely on comforting the child with reassurance and distractions, delaying any discussion or examination related to the suspected abuse until the child appears calm and willing to cooperate. Option D. Immediately begin a detailed forensic examination to collect all possible evidence, explaining to the child that this is necessary for their safety and to help catch the perpetrator, regardless of their current emotional state. The correct answer is A. Gently engage the child in conversation about non-threatening topics to build trust, while discreetly observing for any visible injuries or evidence, and preparing the examination room for a forensic assessment without immediately initiating invasive procedures. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's immediate emotional distress and the forensic nurse's legal and ethical obligations to preserve evidence and maintain the integrity of a potential criminal investigation. The forensic nurse must balance the immediate need for patient comfort and rapport building with the long-term imperative of collecting accurate and admissible evidence. Careful judgment is required to navigate this delicate balance without compromising either the patient's well-being or the legal process. The correct approach represents best professional practice because it prioritizes the patient's immediate safety and emotional needs while simultaneously initiating the necessary steps for forensic evidence collection in a manner that respects the patient's autonomy and dignity. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. Legally, it adheres to guidelines that mandate the preservation of evidence and the proper documentation of patient interactions, ensuring that any collected evidence is admissible in court. This approach acknowledges that a patient's trust is foundational to effective forensic nursing care, and that building that trust is a prerequisite for obtaining accurate information and cooperation. An incorrect approach that focuses solely on immediate comfort without considering evidence preservation would represent a failure to uphold the forensic nurse's role in the justice system. This could lead to the loss or contamination of crucial evidence, rendering it inadmissible and potentially hindering a criminal investigation. Ethically, this would be a breach of professional duty. Another incorrect approach that prioritizes immediate evidence collection over the patient's emotional state would likely alienate the patient, leading to a breakdown in communication and trust. This could result in the patient withholding vital information or refusing consent for necessary examinations, thereby compromising both care and the investigation. This approach would violate the ethical principle of non-maleficence by causing emotional distress and potentially failing to provide adequate care. A third incorrect approach that involves delaying the notification of appropriate authorities or the initiation of evidence collection protocols until the patient is fully stabilized, without any interim measures to secure potential evidence, could also lead to irreversible loss of evidence. This would be a failure to act with due diligence in a situation where time is critical for forensic integrity. The professional decision-making process for similar situations should involve a rapid assessment of the patient's immediate safety and emotional state, followed by a concurrent evaluation of potential forensic evidence. The forensic nurse should then implement a phased approach, prioritizing life-saving interventions and immediate comfort, while discreetly initiating evidence preservation measures and notifying relevant parties as per established protocols. Communication with the patient, explaining the necessity of certain procedures in a sensitive and age-appropriate manner, is paramount. Collaboration with law enforcement and other multidisciplinary team members is also crucial to ensure a coordinated and effective response. Question 4. The evaluation methodology shows a certified forensic nurse assessing a sexual assault victim who is visibly distressed and explicitly states, "I can't do this right now. I don't want anyone touching me further." The nurse has already addressed immediate medical needs and stabilized the victim. The victim's statement is a clear refusal of further examination, including any forensic evidence collection. What is the most ethically and professionally appropriate course of action for the certified forensic nurse in this situation? Option A. Respect the victim's refusal of further examination, document the refusal thoroughly, provide ongoing supportive care, and offer information about available resources, while explaining that forensic evidence collection can be attempted again later if they change their mind. Option B. Immediately cease all interaction with the victim and leave the room, assuming the victim is incapable of making decisions and that further attempts at communication would be harmful. Option C. Proceed with the full forensic examination as per protocol, explaining to the victim that it is necessary for legal purposes and that their cooperation is required, overriding their current refusal due to the critical nature of evidence preservation. Option D. Perform a limited, non-invasive forensic examination focusing only on visible injuries, without explicitly asking for consent for each specific action, to preserve any easily obtainable evidence. The correct answer is A. Respect the victim's refusal of further examination, document the refusal thoroughly, provide ongoing supportive care, and offer information about available resources, while explaining that forensic evidence collection can be attempted again later if they change their mind. Explanation. The evaluation methodology shows a scenario where a certified forensic nurse, CFN, is faced with conflicting priorities during a clinical assessment of a sexual assault victim. The professional challenge lies in balancing the immediate medical needs of the victim, the legal requirements for evidence collection, and the victim's emotional and psychological state. The victim's distress and expressed desire to avoid further examination create an ethical dilemma, requiring the CFN to navigate patient autonomy, the duty to preserve evidence, and the imperative to provide compassionate care. Careful judgment is required to ensure the victim's well-being is paramount while still adhering to forensic protocols. The correct approach represents best professional practice because it prioritizes the victim's immediate needs and autonomy while still attempting to gather crucial information for potential legal proceedings. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. Specifically, it acknowledges that forcing an examination against a victim's wishes can cause further trauma and may compromise the integrity of the evidence due to the victim's heightened distress. The CFN's role is to support the victim, explain the process, and obtain consent for each step, offering alternatives and respecting their decisions as much as possible within the legal and ethical framework. This approach is supported by professional guidelines that emphasize victim-centered care and informed consent in forensic examinations. An incorrect approach that involves proceeding with a full forensic examination without explicit, informed consent, despite the victim's expressed distress and refusal, represents a significant ethical and regulatory failure. This violates the principle of patient autonomy and could be construed as assault or battery, leading to legal repercussions for the nurse and the healthcare facility. It also fails to recognize that a traumatized individual may not be able to provide reliable consent, and forcing the issue can further traumatize the victim, potentially hindering future cooperation with law enforcement. Furthermore, evidence collected under duress or without proper consent may be inadmissible in court, undermining the purpose of the forensic examination. Another incorrect approach, which is to abandon the forensic examination entirely and only provide basic medical care without attempting to explain the forensic process or offer options, is also professionally deficient. While respecting the victim's immediate refusal, this approach fails to uphold the CFN's duty to preserve potential evidence that could be vital for justice. It neglects the opportunity to educate the victim about the importance of evidence collection and to offer them choices regarding the extent of the examination they are comfortable with. This passive approach does not fully meet the comprehensive responsibilities of a CFN, which include both medical care and forensic evidence preservation. The professional decision-making process for similar situations should involve a systematic approach. First, assess the victim's immediate medical needs and ensure their safety and comfort. Second, clearly and compassionately explain the purpose of the forensic examination, the types of evidence that can be collected, and the potential benefits of doing so, emphasizing that their consent is required for each step. Third, actively listen to and validate the victim's concerns and fears. Fourth, offer choices and alternatives, such as delaying certain parts of the examination or performing only the most critical medical interventions. Fifth, document all discussions, the victim's responses, and the decisions made, including any refusal of services. If the victim ultimately refuses a forensic examination, the CFN should still provide appropriate medical care and offer resources for support and follow-up. Question 5. Governance review demonstrates that a forensic nurse has completed a comprehensive examination of a sexual assault victim. The nurse has meticulously documented all physical findings, including injuries, biological evidence, and the victim's statements. The review highlights a potential discrepancy between the victim's account of an event and some of the physical evidence observed. The nurse is now preparing the official report for law enforcement. Which of the following actions best reflects the forensic nurse's role and responsibilities in this situation? Option A. The forensic nurse should delay submitting the report until they can conduct further interviews with the victim to reconcile the discrepancy. Option B. The forensic nurse should present all objective findings, including the observed discrepancy, in the report, clearly noting the victim's statement and the conflicting physical evidence without interpretation or speculation. Option C. The forensic nurse should omit the physical findings that appear to contradict the victim's statement to avoid confusing the investigation and to maintain the victim's trust. Option D. The forensic nurse should interpret the discrepancy for law enforcement, offering a professional opinion on the most likely scenario based on their experience. The correct answer is B. The forensic nurse should present all objective findings, including the observed discrepancy, in the report, clearly noting the victim's statement and the conflicting physical evidence without interpretation or speculation. Explanation. This scenario presents a professional challenge due to the inherent conflict between maintaining patient confidentiality and fulfilling legal reporting obligations in forensic nursing. Forensic nurses operate within a complex ethical and legal landscape where patient trust is paramount, yet they are also mandated reporters with specific duties to law enforcement and the justice system. The need for meticulous documentation, objective evidence collection, and unbiased reporting is critical, as any deviation can compromise an investigation, lead to miscarriages of justice, or violate patient rights. Careful judgment is required to balance these competing demands. The correct approach represents best professional practice because it prioritizes accurate, objective, and legally compliant documentation and reporting. This aligns with the core tenets of forensic nursing, which emphasize evidence preservation and truthful testimony. By meticulously documenting all findings, including any limitations or potential biases, and reporting them through established legal channels, the forensic nurse upholds their professional integrity and contributes effectively to the legal process. This adheres to the ethical guidelines of forensic nursing and relevant legal statutes that govern evidence handling and reporting in criminal matters, ensuring that all actions are defensible and meet the highest standards of professional conduct. An incorrect approach that involves withholding relevant information from law enforcement, even with the intention of protecting patient privacy, represents a significant regulatory and ethical failure. This could violate mandatory reporting laws, obstruct justice, and undermine the investigative process. Furthermore, failing to document findings thoroughly or accurately constitutes a breach of professional duty and can lead to the loss of crucial evidence, rendering it inadmissible in court. Another incorrect approach, such as prematurely sharing sensitive case details with unauthorized individuals, violates patient confidentiality laws and ethical codes, potentially jeopardizing the investigation and the patient's well-being. These actions demonstrate a lack of understanding of the legal framework and ethical responsibilities inherent in forensic nursing. The professional decision-making process for similar situations should involve a thorough understanding of the applicable laws and regulations, including mandatory reporting requirements and patient privacy statutes. Forensic nurses must consult with supervisors, legal counsel, or professional organizations when faced with complex ethical dilemmas. Prioritizing objective evidence collection, accurate documentation, and transparent reporting through appropriate channels are fundamental. Maintaining professional boundaries and adhering to established protocols are essential to navigating the challenges of forensic nursing effectively and ethically. Question 6. Comparative studies suggest that the optimal collection technique for biological evidence from a sexual assault victim's body, specifically for DNA analysis, is a critical determinant of its admissibility in court. Considering the potential for cross-contamination and degradation, which of the following approaches best aligns with established forensic best practices and regulatory guidelines for preserving the integrity of biological evidence? Option A. Using sterile swabs for each distinct area of potential biological evidence, immediately placing each moist swab into a separate sealed plastic bag to prevent drying, and labeling each bag with the victim's name and date of birth. Option B. Using separate, sterile swabs for each distinct area of potential biological evidence, such as individual fingernail scrapings, genital swabs, and oral swabs, and allowing each swab to air dry completely in a well-ventilated area before packaging in breathable paper envelopes. Option C. Swabbing multiple areas of potential biological evidence with the same swab, and then placing the swab in a paper envelope to allow it to dry. Option D. Collecting all biological samples with a single swab, then placing it in a sealed plastic bag to prevent any further environmental exposure. The correct answer is B. using separate, sterile swabs for each distinct area of potential biological evidence, such as individual fingernail scrapings, genital swabs, and oral swabs, and allowing each swab to air dry completely in a well-ventilated area before packaging in breathable paper envelopes. Explanation: this scenario presents a common challenge in forensic nursing, balancing the need for thorough evidence collection with the imperative to maintain the integrity of the biological samples and the chain of custody. The forensic nurse must act as a meticulous collector, a skilled observer, and a diligent documentarian, all while adhering to strict legal and ethical standards. The professional challenge lies in the potential for contamination, degradation, or loss of evidence, which can severely compromise any subsequent legal proceedings. Careful judgment is required to select the most appropriate techniques based on the type of biological evidence, the circumstances of its discovery, and the potential for its evidentiary value. The correct approach represents best professional practice because it prioritizes the preservation of biological evidence in a manner that is scientifically sound and legally defensible. This involves using appropriate collection materials that do not interfere with DNA analysis, employing techniques that minimize cross-contamination, and meticulously documenting every step of the process. Adherence to established protocols, such as those outlined by the U.S. Department of Justice's National Institute of Justice, NIJ, Guidelines for Sexual Assault Evidence Collection, ensures that the evidence is collected in a way that meets the Daubert or Frye standards for admissibility in court. This meticulousness safeguards the integrity of the evidence from the point of collection through to its presentation in court, upholding the principles of due process and the pursuit of justice. An incorrect approach that involves using a single swab for multiple areas of potential biological evidence, such as both the victim's hands and under their fingernails, represents a significant regulatory and ethical failure. This technique dramatically increases the risk of cross-contamination, rendering the DNA profile from one area indistinguishable from another, or creating a mixed profile that is difficult or impossible to interpret. Ethically, it fails to provide a clear and accurate representation of the evidence. Legally, it can lead to the exclusion of crucial evidence due to compromised integrity, violating the forensic nurse's duty to collect evidence reliably. Another incorrect approach, such as air drying all biological samples in a poorly ventilated area before packaging, poses a risk of microbial degradation and potential mold growth, which can damage DNA. This failure to control environmental factors for sample preservation violates best practices and can lead to the loss of valuable genetic material, impacting the evidentiary value and potentially leading to its inadmissibility. Furthermore, failing to document the specific location where each swab was taken, or the exact time of collection, constitutes a failure in maintaining the chain of custody, a fundamental legal requirement. This omission can create doubt about the origin and handling of the evidence, making it vulnerable to challenges in court. The professional decision-making process for similar situations should involve a systematic approach. First, identify the type of biological evidence present and its location. Second, consult relevant protocols and guidelines, e.g., NIJ guidelines, institutional policies, for the specific type of evidence and the alleged crime. Third, select the least intrusive yet most effective collection method that preserves the integrity of the evidence and minimizes contamination risk. Fourth, meticulously document all actions, observations, and the chain of custody. And finally, ensure proper packaging and storage to maintain sample viability. This structured approach ensures that all legal, ethical, and scientific considerations are addressed, leading to the collection of high-quality, admissible evidence. Question 7. Assessment of the impact of different collection techniques on the integrity of trace evidence, specifically hair and fiber samples, in a sexual assault investigation, considering the regulatory framework for forensic evidence handling. Option A. Using a single, slightly damp cotton swab to collect all visible hairs and fibers from both the victim's clothing and skin, then placing the swab in a plastic bag. Option B. Collecting hair and fiber samples by hand, placing them directly into a single, unsealed plastic bag, and relying on verbal notes to document the collection location. Option C. Employing a vacuum device with a clean filter to collect all visible hairs and fibers from the victim's clothing and skin, then storing the filter in a sealed plastic bag without further labeling. Option D. Utilizing a sterile, dry swab for initial collection of visible hairs and fibers from the victim's clothing, followed by a separate sterile, dry swab for the victim's skin, with both samples then placed in separate, clearly labeled, breathable paper envelopes. Correct answer is D. Utilizing a sterile, dry swab for initial collection of visible hairs and fibers from the victim's clothing, followed by a separate sterile, dry swab for the victim's skin, with both samples then placed in separate, clearly labeled, breathable paper envelopes. Explanation: this scenario is professionally challenging due to the critical nature of trace evidence collection in establishing a chain of custody and ensuring the integrity of potential evidence. Forensic nurses must meticulously follow established protocols to avoid contamination, degradation, or loss of crucial biological or physical evidence. The pressure of a real-time investigation, coupled with the need for precise technique, demands a high level of attention to detail and adherence to regulatory guidelines. The correct approach represents best professional practice because it prioritizes the preservation and accurate documentation of trace evidence, directly aligning with the legal and ethical mandates of forensic nursing. This includes utilizing appropriate, sterile collection tools, maintaining a meticulous chain of custody, and documenting each step of the process thoroughly. Such practices are essential for ensuring that the collected evidence is admissible in court and contributes effectively to the investigation. Adherence to these principles upholds the nurse's professional responsibility to the victim, the legal system, and the pursuit of justice. An incorrect approach, such as using a single swab for multiple areas or failing to properly seal and label evidence containers, represents significant regulatory and ethical failures. These actions can lead to cross-contamination, rendering the evidence unreliable and potentially inadmissible. Ethically, it breaches the duty of care to the victim by compromising the investigation and the potential for justice. Regulatory frameworks, such as those governing forensic evidence handling, mandate specific procedures to prevent such failures. Failure to comply with these mandates can result in disciplinary action, legal challenges to evidence, and a miscarriage of justice. Another incorrect approach, like relying on memory for details instead of immediate, thorough documentation, violates the principle of accurate record-keeping, which is a cornerstone of forensic practice and legal proceedings. Professional decision-making in similar situations requires a systematic approach. First, understanding the specific legal and regulatory requirements for evidence collection in the relevant jurisdiction. Second, applying established forensic protocols for the type of evidence being collected. Third, prioritizing the integrity and chain of custody of the evidence above all else. Finally, thorough and accurate documentation at every stage is paramount. This structured approach ensures that all actions are legally sound, ethically defensible, and contribute to the highest quality of forensic evidence. Question 8. When evaluating the scene of a sexual assault examination, what is the most critical initial step a certified forensic nurse must take regarding potential trace evidence found on the patient's clothing to ensure its integrity for subsequent legal proceedings? Option A. Photograph the clothing in situ, then instruct the patient to carefully remove the clothing and place it in a designated evidence container, without direct handling by the nurse. Option B. Prioritize patient comfort and privacy by allowing the patient to manage their own clothing removal and storage, with minimal direct forensic intervention. Option C. Promptly remove all clothing items and place them in a single plastic bag to prevent further contamination, then dispose of them in a designated biohazard waste receptacle. Option D. Immediately collect all clothing items, package them separately in breathable paper bags, and label them with the patient's name, date, time, and collector's initials, ensuring they are stored in a secure, temperature-controlled environment until transfer to law enforcement. The correct answer is D. Immediately collect all clothing items, package them separately in breathable paper bags, and label them with the patient's name, date, time, and collector's initials, ensuring they are stored in a secure, temperature-controlled environment until transfer to law enforcement. Explanation: this scenario is professionally challenging due to the inherent tension between immediate patient care needs and the long-term imperative of preserving forensic evidence. A forensic nurse must balance the urgency of medical intervention with the meticulous requirements of evidence handling to ensure its admissibility in legal proceedings. Failure to do so can compromise an investigation and deny justice. The correct approach represents best professional practice because it prioritizes the integrity of the evidence from the outset, aligning with established forensic protocols and legal standards for evidence collection and preservation. This proactive stance ensures that the evidence remains untainted, properly documented, and securely stored, thereby maximizing its probative value in court. Adherence to these protocols is often mandated by law and professional guidelines to maintain the chain of custody and prevent contamination or degradation. An incorrect approach that involves immediate disposal of potentially relevant items without proper documentation or collection fails to meet the legal and ethical standards for forensic evidence. This constitutes a significant regulatory failure, as it violates established protocols for evidence handling, potentially leading to the exclusion of crucial evidence and undermining the investigative process. Another incorrect approach, such as storing evidence in a manner that compromises its integrity, e.g., in a non-secure location or with incompatible materials, directly contravenes guidelines designed to prevent tampering, degradation, or loss, thereby failing to uphold the chain of custody and potentially rendering the evidence inadmissible. Professionals should employ a decision-making framework that begins with identifying all potential forensic evidence at the earliest opportunity. This involves a systematic assessment of the patient's environment and the patient's person. Subsequently, all identified evidence should be documented, photographed, if appropriate and not interfering with patient care, collected using appropriate sterile techniques and containers, and immediately secured according to established protocols. The chain of custody must be meticulously maintained throughout this process, with all transfers and handling recorded. Collaboration with law enforcement or designated evidence custodians is crucial to ensure proper storage and transport. Question 9. The audit findings indicate a need to evaluate the foundational knowledge of forensic nursing principles among practitioners. Which of the following best reflects an understanding of the historical evolution of forensic nursing as a distinct specialty? Option A. Understanding forensic nursing as an extension of general nursing practice, with no significant historical divergence or specialized development beyond standard medical care. Option B. Recognizing that forensic nursing emerged from a convergence of public health initiatives, victim advocacy movements, and the increasing need for scientifically sound evidence in legal proceedings, leading to specialized training and practice standards. Option C. Believing that forensic nursing is a recent development primarily driven by advancements in forensic technology and the expansion of emergency department services. Option D. Focusing exclusively on the role of forensic nurses in post-mortem examinations, overlooking their broader historical contributions to living victim care and legal testimony. The correct answer is B. Recognizing that forensic nursing emerged from a convergence of public health initiatives, victim advocacy movements, and the increasing need for scientifically sound evidence in legal proceedings, leading to specialized training and practice standards. Explanation. The audit findings indicate a need to assess the historical understanding of forensic nursing principles within the practice. This scenario is professionally challenging because it requires the practitioner to demonstrate not just current knowledge, but also an understanding of how the field has developed, which is crucial for contextualizing current practices and advocating for future advancements. A deep understanding of the history of forensic nursing, including its roots in public health, victim advocacy, and the integration of nursing science with legal and criminal justice systems, is essential for providing comprehensive care and maintaining professional integrity. The correct approach represents best professional practice because it directly addresses the audit's focus on historical evolution. It demonstrates an awareness of the foundational principles and key milestones that have shaped forensic nursing into its current form. This historical perspective is vital for understanding the ethical underpinnings and regulatory frameworks that have evolved alongside the specialty, ensuring that current practices are informed by past experiences and legal precedents. Adherence to the historical trajectory of forensic nursing, as recognized by professional bodies and academic discourse, is paramount for maintaining competence and ethical practice. An incorrect approach that focuses solely on the most recent technological advancements, without acknowledging the historical development of evidence collection and patient care, would be professionally unacceptable. This failure stems from a lack of understanding of how these technologies were integrated and the ethical considerations that arose during their adoption. It neglects the foundational principles of patient advocacy and the legal requirements that have guided forensic nursing since its inception. Another incorrect approach might overemphasize the medical aspects of forensic nursing while disregarding its crucial role in the legal system and victim support, failing to grasp the interdisciplinary nature that has been a hallmark of its evolution. This would represent a significant regulatory and ethical failure by not recognizing the full scope of practice as it has historically been defined and legally mandated. The professional decision-making process for similar situations should involve a comprehensive review of the specialty's historical development, including key figures, seminal research, legislative changes, and the establishment of professional organizations. This allows for a nuanced understanding of the current regulatory landscape and ethical obligations, ensuring that practice is both compliant and informed by the rich history of forensic nursing. It requires a commitment to lifelong learning that encompasses both contemporary knowledge and the historical context that underpins it. Question 10. Cost-benefit analysis shows that delaying a comprehensive forensic examination to obtain explicit, informed consent from a conscious and competent adult victim of alleged sexual assault, who is currently expressing distress and a desire for immediate medical attention, could compromise the integrity of crucial evidence. However, proceeding with the examination without this consent, despite the potential for evidence preservation, carries significant ethical and legal risks. What is the most ethically and legally sound course of action for the certified forensic nurse in this immediate situation? Option A. Proceed with the forensic examination immediately to preserve evidence, assuming implied consent due to the nature of the alleged assault and the patient's presence in the healthcare setting. Option B. Prioritize obtaining explicit, informed consent from the patient for the forensic examination after addressing their immediate medical needs, clearly explaining the process and their rights, and documenting their decision. Option C. Conduct a limited forensic examination to collect the most critical evidence without explicitly informing the patient of the forensic nature of the examination, to avoid causing further distress. Option D. Focus solely on immediate medical stabilization and comfort, deferring any discussion or attempt at forensic examination until the patient explicitly requests it, even if this means significant evidence degradation. The correct answer is B. Prioritize obtaining explicit, informed consent from the patient for the forensic examination after addressing their immediate medical needs, clearly explaining the process and their rights, and documenting their decision. Explanation. This scenario presents a significant ethical dilemma for a certified forensic nurse, CFN, operating within the U.S. regulatory framework governing healthcare and forensic investigations. The challenge lies in balancing the immediate needs of a potentially vulnerable patient with the legal and ethical obligations to preserve evidence and report certain findings. The CFN must navigate conflicting duties: the duty of care to the patient, which includes providing comfort and appropriate medical intervention, and the duty to uphold legal and investigative processes, which may require specific evidence collection and reporting procedures. Inherent power imbalance between the patient and the healthcare provider, coupled with the sensitive nature of forensic examinations, necessitates meticulous judgment and adherence to established protocols. The correct approach prioritizes patient autonomy and informed consent while meticulously adhering to forensic evidence preservation guidelines. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and justice, fair treatment. Specifically, it respects the patient's right to refuse examination or treatment, even if that refusal might compromise evidence collection. However, it also mandates thorough documentation of the patient's condition and any refusal, and a clear, non-coercive explanation of the forensic nurse's role and the potential implications of their decisions. This approach is supported by the American Nurses Association, ANA, Code of Ethics, which emphasizes patient advocacy and respect for patient rights, and by established forensic nursing protocols that stress the importance of consent and patient well-being throughout the examination process. An incorrect approach that proceeds with a forensic examination without explicit, informed consent from the patient, even if the nurse believes it is for the patient's benefit or to gather crucial evidence, constitutes a violation of patient autonomy and potentially battery. This disregards the patient's right to self-determination, a cornerstone of ethical healthcare practice. Furthermore, if the patient is a minor or incapacitated, obtaining consent from a legal guardian or following specific legal protocols for such situations is paramount, Proceeding without this would be a significant regulatory and ethical failure. Another incorrect approach would be to abandon the patient's immediate medical needs in favor of solely focusing on evidence collection, as this neglects the primary duty of care and could lead to patient harm, violating the principle of beneficence. Finally, failing to document the patient's condition, any refusals, or the rationale for the chosen course of action would be a breach of professional responsibility and could have legal ramifications, hindering any subsequent investigation or legal proceedings. A professional decision-making process in such situations should involve a systematic approach. First, assess the patient's immediate medical needs and stabilize them if necessary. Second, clearly explain the forensic nurse's role, the purpose of the examination, and the patient's rights, including the right to refuse. Third, obtain informed consent if the patient agrees to the examination. If the patient refuses, document this refusal and the explanation provided. Fourth, if consent is given, proceed with the examination following established forensic protocols, ensuring meticulous evidence collection and documentation. If the patient is unable to consent, follow legal and institutional guidelines for obtaining consent from a surrogate decision maker or for emergency situations. Throughout the process, maintain open communication with the patient and other healthcare professionals involved. Question 11. Upon reviewing the forensic evidence log for a sexual assault case, a forensic nurse notes that a critical piece of biological evidence collected at the scene was transferred to the crime lab. However, the log only indicates the date of transfer and the name of the individual who received it at the lab, but it does not detail the specific time of transfer or the name of the forensic nurse who transported it from the scene to the lab. Which of the following actions best upholds the integrity of the chain of custody and adheres to best professional practice in this scenario? Option A. Rely on the lab's internal receiving log to supplement the missing information, as it likely contains the necessary details. Option B. Immediately amend the forensic evidence log to include the precise time of transfer and the name of the transporting forensic nurse, ensuring all parties involved in the chain of custody are accurately documented. Option C. Assume the transfer occurred at a reasonable time and that the transporting nurse's identity is implied by their role, proceeding with the case without further documentation. Option D. File a report detailing the omission but do not amend the original log, as altering official documentation is prohibited. The correct answer is B. Immediately amend the forensic evidence log to include the precise time of transfer and the name of the transporting forensic nurse, ensuring all parties involved in the chain of custody are accurately documented. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of maintaining the integrity of evidence. Break in the chain of custody can render forensic evidence inadmissible in legal proceedings, undermining the entire investigative and judicial process. The forensic nurse's responsibility extends beyond direct patient care to ensuring that any evidence collected is handled in a manner that preserves its evidentiary value and meets stringent legal standards. This requires meticulous attention to detail and a thorough understanding of established protocols. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the documentation of every transfer of possession of the evidence. This aligns with the fundamental principles of chain of custody, which are legally mandated to ensure the authenticity and reliability of evidence. In the U.S., this is governed by rules of evidence at both the federal and state levels, as well as specific agency guidelines, e.g., FBI, state law enforcement. Proper documentation, including the names of individuals involved, dates, times, and the purpose of the transfer, creates an unbroken, verifiable record from the point of collection to its presentation in court. This meticulous record-keeping is essential for withstanding legal scrutiny and preventing challenges to the evidence's admissibility. Incorrect approaches analysis. One incorrect approach fails to document the transfer of the evidence from the collection point to the laboratory. This creates a significant gap in the chain of custody. Ethically and legally, this is unacceptable as it raises questions about whether the evidence was tampered with, contaminated, or even substituted during the unaccounted-for period. This failure directly violates the principles of evidence integrity and can lead to the exclusion of crucial evidence, potentially jeopardizing a case. Another incorrect approach involves a nurse signing for evidence collected by another party without physically receiving or inspecting it. This is a critical ethical and regulatory failure. The forensic nurse has a professional obligation to ensure the accuracy of their documentation and the integrity of the evidence they are responsible for. Falsely attesting to possession without actual transfer or verification is a breach of trust and professional conduct. It undermines the reliability of the chain of custody and can be interpreted as negligence or even intentional misconduct, leading to severe professional and legal repercussions. Professional reasoning. Professionals should employ a decision-making framework that prioritizes adherence to established protocols and legal requirements. This involves 1. Understanding the specific chain of custody requirements for the jurisdiction and the type of evidence. 2. Meticulously documenting every step of the evidence handling process, including collection, transfer, storage, and analysis. 3. Verifying the identity and condition of the evidence at each transfer point. 4. Seeking clarification or additional training when unsure about any aspect of the protocol. 5. Recognizing that the integrity of the evidence is paramount and directly impacts the pursuit of justice. Question 12. During the evaluation of a potential sexual assault, a forensic nurse is tasked with collecting biological evidence. The nurse has a limited time frame due to the patient's distress and the need for prompt medical intervention. Which of the following approaches best optimizes the collection process while maintaining the integrity of forensic evidence? Option A. Use readily available household items for collection if specialized kits are not immediately accessible, ensuring the samples are sealed in any available container. Option B. Collect samples as quickly as possible, focusing on the most obvious areas, and complete detailed documentation after the patient's immediate medical needs are addressed. Option C. Prioritize immediate collection of all visible biological samples using a standardized kit, documenting each step meticulously and initiating the chain of custody immediately. Option D. Delegate the collection of certain samples to less experienced staff to expedite the process, with the forensic nurse performing a final review of the collected items. Correct answer is C. Prioritize immediate collection of all visible biological samples using a standardized kit, documenting each step meticulously and initiating the chain of custody immediately. Explanation. This scenario is professionally challenging due to the critical nature of forensic evidence collection in legal proceedings. The integrity of the evidence directly impacts the accuracy of investigations and the fairness of justice. Forensic nurses must navigate complex legal requirements, ethical considerations, and the potential for evidence degradation or contamination. Meticulous attention to detail and adherence to established protocols are paramount. The correct approach represents best professional practice because it prioritizes the preservation of evidence integrity, which is a fundamental requirement under the regulatory framework governing forensic nursing. This includes meticulous documentation, proper chain of custody procedures, and the use of validated collection methods. Adherence to these standards ensures that the evidence is admissible in court and accurately reflects the facts of the case, upholding the nurse's professional and legal obligations. An incorrect approach that involves rushing the collection process without proper documentation or using non-standardized equipment would represent a significant regulatory and ethical failure. This could lead to evidence being deemed inadmissible due to chain of custody breaches or contamination, thereby jeopardizing the investigation and potentially leading to a miscarriage of justice. Failure to follow established protocols violates professional standards of care and could result in disciplinary action. Another incorrect approach, such as failing to secure the scene adequately before collection, introduces the risk of contamination, compromising the reliability of the collected evidence and violating the forensic nurse's duty to preserve evidence integrity. Professionals should employ a decision-making framework that begins with a thorough understanding of the specific legal and regulatory requirements for evidence collection in their jurisdiction. This involves consulting relevant statutes, professional guidelines, and institutional policies. The next step is to meticulously plan the collection process, ensuring all necessary equipment and personnel are available and that the environment is secured. During collection, constant vigilance regarding documentation, chain of custody, and adherence to validated protocols is essential. Finally, a post-collection review of all documentation and procedures ensures completeness and accuracy, reinforcing the integrity of the forensic process. Question 13. Governance review demonstrates a need to reinforce best practices in forensic evidence collection. A certified forensic nurse is attending to a patient who may have been involved in a physical assault. The nurse identifies potential biological evidence on the patient's skin, clothing, and in the immediate environment. To ensure the integrity and admissibility of this evidence, which of the following collection techniques is most critical to uphold? Option A. Collecting all potential biological samples with a single, large sterile swab and placing them together in a sealed plastic bag for transport. Option B. Using a single, non-sterile swab to collect visible biological material from multiple locations on the patient's body and the surrounding environment. Option C. Collecting all evidence in a single, unsealed plastic bag, focusing primarily on speed to ensure the patient receives prompt medical attention. Option D. Utilizing sterile swabs for each distinct biological sample, packaging each item separately in breathable paper envelopes, and meticulously documenting the chain of custody for all collected items. The correct answer is D. Utilizing sterile swabs for each distinct biological sample, packaging each item separately in breathable paper envelopes, and meticulously documenting the chain of custody for all collected items. Explanation. This scenario presents a professional challenge due to the critical need for meticulous and legally defensible evidence collection in a sensitive forensic context. The nurse must balance immediate patient care with the imperative to preserve the integrity of potential evidence, recognizing that any compromise could render it inadmissible in legal proceedings. The challenge lies in applying established forensic protocols under potentially stressful and time-sensitive conditions, ensuring that the collection process is both scientifically sound and compliant with relevant legal standards. The correct approach, which involves meticulously documenting the chain of custody and using appropriate sterile collection materials for each distinct type of physical evidence, represents best professional practice. This aligns with the fundamental principles of forensic science and the legal requirements for evidence admissibility. Specifically, maintaining an unbroken chain of custody is paramount to demonstrating that the evidence has not been tampered with, altered, or contaminated from the moment of collection to its presentation in court. The use of sterile, appropriate materials for each evidence type, e.g., swabs for biological samples, paper bags for clothing, prevents cross-contamination and preserves the evidentiary value of each item. This adheres to guidelines established by forensic bodies and legal precedents that dictate the standards for evidence handling. An incorrect approach that involves using a single, non-sterile swab to collect multiple types of potential biological evidence from different areas of the patient's body is professionally unacceptable. This failure constitutes a significant breach of forensic protocol, leading to cross-contamination. Ethically and legally, this compromises the integrity of the evidence, rendering it unreliable and likely inadmissible. It violates the principle of maintaining evidence purity, a cornerstone of forensic investigation. Another incorrect approach, such as failing to document the exact location from which each piece of evidence was collected, introduces ambiguity and weakens the evidentiary link to the patient or the alleged incident. This lack of specificity can be exploited by the defense to question the relevance and reliability of the evidence. Legally, this omission can lead to the exclusion of the evidence. A third incorrect approach, such as storing all collected evidence in a single, unsealed plastic bag, also leads to contamination and degradation of the evidence. This violates the principle of proper evidence packaging, which is designed to preserve its condition and prevent alteration. Ethically, it demonstrates a lack of diligence and respect for the investigative process. The professional decision-making process for similar situations should involve a systematic approach. First, prioritize immediate patient safety and medical needs. Concurrently, identify potential areas of evidentiary significance. Then, consult and strictly adhere to established forensic collection protocols and institutional guidelines. This includes using the correct, sterile collection materials for each specific type of evidence and meticulously documenting every step of the collection process, including the source, time, date, and collector's identity. Maintaining an unbroken chain of custody throughout the process is non-negotiable. If there is any doubt about the correct procedure, seeking immediate guidance from a supervisor or a forensic expert is essential. Question 14. Consider a scenario where a certified forensic nurse is the first responder to a scene involving a suspected sexual assault. The patient is conscious but visibly distressed and reports experiencing pain. The nurse's immediate priority is to assess the patient's medical condition and provide necessary care. What is the most appropriate course of action for the certified forensic nurse in this situation? Adhering strictly to U.S. regulatory frameworks and ethical guidelines for forensic nursing. Option A. Provide immediate medical care to stabilize the patient and simultaneously initiate evidence preservation protocols, ensuring all actions are documented meticulously and in accordance with legal requirements. Option B. Prioritize the collection of all potential forensic evidence before attending to the patient's immediate medical needs, as the integrity of evidence is paramount in sexual assault cases. Option C. Administer pain medication and comfort measures, then release the patient with instructions to contact law enforcement later if they wish, without initiating any evidence collection or documentation. Option D. Focus exclusively on providing immediate medical treatment to alleviate the patient's pain and distress, deferring any evidence collection or preservation until law enforcement has fully secured the scene. The correct answer is A. Provide immediate medical care to stabilize the patient and simultaneously initiate evidence preservation protocols, ensuring all actions are documented meticulously and in accordance with legal requirements. Explanation. This scenario presents a professional challenge due to the inherent tension between the immediate needs of a patient presenting with potential trauma and the legal and ethical obligations of a forensic nurse. The forensic nurse must balance providing immediate, competent medical care with the imperative to preserve evidence that may be crucial for a criminal investigation. This requires a nuanced understanding of their dual role and the specific legal and ethical frameworks governing forensic nursing practice within the United States, as this exam is for a certified forensic nurse in the U.S. The correct approach prioritizes patient safety and medical stabilization, while simultaneously initiating evidence preservation protocols. This aligns with the core tenets of forensic nursing, which integrate nursing science with forensic science, encompassing the identification, documentation, and collection of evidence for legal proceedings. Best professional practice dictates that the forensic nurse acts as a patient advocate and a neutral, objective witness. This approach ensures that the patient receives necessary medical attention without compromising the integrity of potential evidence, thereby upholding both patient rights and the pursuit of justice. This is supported by guidelines from organizations such as the International Association of Forensic Nurses, IAFN, which emphasize the importance of evidence preservation within the context of patient care. An incorrect approach that focuses solely on immediate medical treatment without any consideration for evidence preservation would fail to meet the forensic component of the role. This would represent a significant ethical and professional lapse, potentially hindering a criminal investigation and failing to fulfill the nurse's responsibilities as a forensic practitioner. Conversely, an approach that prioritizes evidence collection to the detriment of immediate medical stabilization would violate fundamental nursing ethics and potentially endanger the patient's life, constituting gross negligence and a breach of the nurse's duty of care. Another incorrect approach might involve prematurely releasing the patient or the scene without proper documentation or evidence collection, which would also compromise the investigation and violate professional standards. The professional decision-making process in such situations requires a systematic approach. First, assess the patient's immediate medical needs and stabilize them. Second, consult with law enforcement or the appropriate legal authority to understand the scope of the investigation and evidence requirements. Third, meticulously document all findings and interventions, including any evidence collected or preserved. And fourth, ensure all actions are performed in accordance with relevant state and federal laws, as well as professional ethical codes. Question 15. The review process indicates a forensic nurse is assessing a victim of sexual assault who presents with significant emotional distress and expresses a desire to return home immediately, despite visible injuries and a clear need for medical examination and evidence collection. Which approach best aligns with the forensic nurse's responsibilities in assessing victim needs and resources within the established regulatory framework? Option A. Assume the victim's primary need is to leave the situation and provide them with a referral to a general counseling service without conducting a detailed assessment of their specific medical, safety, or legal support needs. Option B. Conduct a thorough, victim-centered assessment to identify immediate safety concerns, medical needs, psychological distress, and potential legal/social support requirements, collaboratively developing a plan that addresses the victim's stated needs and preferences while explaining the importance of medical examination and evidence collection. Option C. Focus exclusively on immediate medical stabilization and evidence collection, explaining to the victim that their personal preferences must be secondary to the legal requirements of the investigation. Option D. Immediately facilitate the victim's return home to minimize further distress, documenting their injuries and wishes without pursuing further medical examination or resource connection. The correct answer is B. Conduct a thorough, victim-centered assessment to identify immediate safety concerns, medical needs, psychological distress, and potential legal/social support requirements, collaboratively developing a plan that addresses the victim's stated needs and preferences while explaining the importance of medical examination and evidence collection. Explanation. Scenario analysis. This scenario is professionally challenging because the forensic nurse must navigate a complex web of victim needs, available resources, and legal/ethical obligations within a specific regulatory framework. The victim's immediate safety and well-being are paramount, but this must be balanced with the need to preserve evidence, ensure accurate documentation, and connect the victim with appropriate support services. The nurse's role extends beyond immediate medical care to encompass advocacy, resource identification, and collaboration with other professionals, all while adhering to strict jurisdictional guidelines for forensic nursing practice. The potential for re-traumatization necessitates a sensitive and trauma-informed approach. Correct approach analysis. The correct approach prioritizes a comprehensive, victim-centered assessment that identifies immediate safety concerns, medical needs, psychological distress, and potential legal/social support requirements. This involves actively listening to the victim, conducting a thorough physical and psychosocial evaluation, and collaboratively developing a plan that addresses their stated needs and preferences. This approach aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory requirements for patient advocacy and comprehensive care. It ensures that the victim's voice is central to the decision-making process, empowering them and promoting their recovery. The forensic nurse acts as a crucial link to appropriate services, ensuring continuity of care and access to justice. Incorrect approaches analysis, focusing solely on immediate medical stabilization without addressing the victim's psychological and social needs, fails to meet the holistic requirements of forensic nursing care. This approach neglects the long-term impact of trauma and may leave the victim feeling unsupported and unheard, potentially hindering their recovery and willingness to engage with the legal process. It violates the ethical duty to provide comprehensive care and may contravene jurisdictional guidelines that mandate psychosocial support. Prioritizing evidence collection above all else, to the exclusion of the victim's immediate comfort and emotional state, is ethically problematic and can be detrimental to the victim's well-being. While evidence preservation is critical in forensic nursing, it should not come at the expense of the victim's dignity and safety. This approach can lead to re-traumatization and a breakdown of trust, impacting the victim's ability to provide accurate information and participate in their own care. It may also violate patient rights and ethical standards regarding compassionate care. Assuming the victim's needs based on stereotypes or limited information without direct assessment is a significant professional failing. This can lead to misidentification of needs, inappropriate interventions, and a lack of trust. It demonstrates a lack of cultural competence and an abdication of the nurse's responsibility to conduct a thorough and individualized assessment, violating ethical principles of justice and respect for persons. Professional reasoning. Professionals should employ a structured, yet flexible assessment framework that begins with establishing rapport and ensuring the victim's safety. This involves active listening, open-ended questioning, and a non-judgmental demeanor. The assessment should systematically cover medical, psychological, social, and legal needs, always in collaboration with the victim. Resource identification should be based on the victim's expressed needs and preferences, with clear explanations of available options and their implications. Documentation should be accurate, objective, and comprehensive, reflecting the assessment findings and the plan of care. Continuous evaluation and adaptation of the plan are essential as the victim's needs evolve. Adherence to jurisdictional laws, regulations, and professional ethical codes is non-negotiable throughout the entire process. Question 16. Which approach would be most effective in conducting a forensic interview with a victim whose cultural background significantly differs from the nurse's, to ensure both accurate data collection and the victim's well-being. Option A, making assumptions about the victim's experiences and reactions based on common stereotypes associated with their cultural group to expedite the interview process. Option B, employing a culturally humble approach that involves active listening, open-ended questions, and a willingness to learn about the victim's cultural context and preferences, while empowering the victim to guide the pace and content of the interview. Option C, utilizing a standardized, protocol-driven interview script that has been proven effective in general forensic settings, assuming that the core elements of victimization are universally understood and experienced. Option D, prioritizing the collection of all legally mandated forensic evidence first, with cultural considerations addressed only if they directly impede the physical examination or evidence gathering. The correct answer is B, employing a culturally humble approach that involves active listening, open-ended questions, and a willingness to learn about the victim's cultural context and preferences, while empowering the victim to guide the pace and content of the interview. Explanation: this scenario is professionally challenging because it requires a forensic nurse to navigate the complex interplay of cultural beliefs, societal norms, and individual experiences of victimization. The nurse must provide competent and sensitive care without imposing their own cultural biases or making assumptions about the victim's experiences. Careful judgment is required to ensure that the victim feels safe, respected, and understood, which is paramount for effective forensic examination and support. The correct approach represents best professional practice because it prioritizes a victim-centered, culturally humble methodology. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory frameworks that mandate culturally competent care. By actively seeking to understand the victim's cultural context and empowering them to guide the process, the nurse fosters trust and facilitates the collection of accurate information, which is crucial for both their immediate well-being and any subsequent legal proceedings. This approach upholds the dignity of the victim and ensures that their unique needs are met within their own cultural framework. An incorrect approach that relies on broad generalizations about cultural groups fails to recognize the diversity within any population and can lead to stereotyping. This is a significant ethical failure as it can alienate the victim, hinder rapport building, and result in incomplete or inaccurate forensic data. It also violates the principle of individualized care. Another incorrect approach that dismisses or minimizes the victim's cultural beliefs in favor of a standardized, westernized protocol disregards the victim's lived experience and can be perceived as disrespectful or invalidating. This is an ethical failure that breaches the duty of care and can cause further trauma. A third incorrect approach that focuses solely on the legalistic aspects of the forensic examination without adequate consideration for the victim's cultural and emotional state neglects the holistic nature of forensic nursing care. This can lead to a failure to gather crucial contextual information and can re-traumatize the victim, representing a failure to meet professional standards of care. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases. This is followed by active listening and open-ended questioning to understand the victim's perspective and cultural background. The nurse should then integrate this understanding into their assessment and care plan, always prioritizing the victim's comfort and agency. Collaboration with cultural liaisons or interpreters, when necessary, is also a key component of this framework. Question 17. Risk assessment procedures indicate that a forensic nurse is documenting injuries on a victim. Which of the following approaches best ensures the integrity and admissibility of the evidence collected? Option A, taking quick photographs of the most prominent injuries without a scale or consistent lighting. Option B, documenting injuries with detailed written notes, including measurements and context, and taking standardized photographs with a scale and proper lighting from multiple angles. Option C, relying solely on detailed verbal descriptions of injuries to the lead investigator at the scene. Option D, rearranging the scene slightly to make the injuries more visually apparent for photographic documentation. The correct answer is B, documenting injuries with detailed written notes, including measurements and context, and taking standardized photographs with a scale and proper lighting from multiple angles. Explanation: scenario analysis. This scenario is professionally challenging because it involves a critical juncture in a forensic investigation where the integrity of evidence is paramount. The forensic nurse must balance the immediate need to document injuries with the long-term requirement of preserving evidence for legal proceedings. The pressure of time, potential for patient distress, and the need for meticulous detail create a high-stakes environment where errors can have significant legal ramifications. The nurse's actions directly impact the prosecution or defense of a case, demanding a high degree of accuracy, adherence to protocol, and ethical conduct. Correct approach analysis. The correct approach prioritizes comprehensive, objective, and legally defensible documentation and photography. This aligns with the fundamental principles of forensic nursing practice, which are guided by established protocols and legal standards. Detailed notes, including measurements, descriptions of injuries, and the context of their discovery, are essential. Photography, when conducted according to established forensic guidelines, e.g., using proper lighting, scale, and multiple angles, provides an objective and permanent record that can be reviewed by investigators, legal professionals, and potentially a jury. This approach ensures that the evidence is preserved in its original state and that the nurse's observations are accurately and reliably conveyed, meeting the evidentiary standards required in court. Adherence to these practices is crucial for maintaining the chain of custody and ensuring the admissibility of evidence. Incorrect approaches analysis. One incorrect approach involves relying solely on verbal descriptions without contemporaneous written notes or photographic evidence. This is ethically and legally deficient because verbal accounts are subjective, prone to memory degradation, and lack the objective permanence required for forensic evidence. It fails to meet the standards of meticulous documentation expected in forensic investigations and significantly compromises the integrity and admissibility of the findings. Another incorrect approach is to take photographs without a scale or proper lighting, or to focus only on the most obvious injuries. This is problematic because the absence of a scale makes it impossible to accurately determine the size of injuries, a critical detail in many forensic assessments. Poor lighting or inadequate angles can obscure important features or create misleading impressions. This lack of standardization and thoroughness undermines the scientific validity of the photographic evidence and its utility in legal proceedings. It also fails to capture the full spectrum of injuries, potentially omitting crucial evidence. A third incorrect approach is to alter the scene or manipulate the evidence to make it appear more visually striking for photographic purposes. This is a severe ethical and legal violation. Forensic evidence must be documented as it is found, without any alteration or staging. Such actions constitute tampering with evidence, which can lead to the exclusion of all evidence collected by that nurse, severe professional sanction, and criminal charges. It fundamentally betrays the principles of objectivity and integrity that underpin forensic science. Professional reasoning. Professionally, a forensic nurse should employ a decision-making framework that begins with understanding the legal and ethical obligations of evidence collection and documentation. This involves a thorough review of relevant forensic protocols and jurisdictional laws governing evidence. The nurse must then assess the scene and the patient, identifying all potential evidence. A systematic approach to documentation, including detailed written notes and standardized photographic techniques, should be implemented. This framework emphasizes objectivity, accuracy, and preservation of the chain of custody. When in doubt about a procedure, consulting with experienced forensic investigators or legal counsel is a critical step. The ultimate goal is to produce evidence that is both scientifically sound and legally admissible, supporting the pursuit of justice. Question 18. Quality control measures reveal a pattern of forensic nurses prioritizing the immediate collection of physical evidence over establishing a safe and trusting environment for a survivor of sexual assault. Which of the following approaches best aligns with the principles of trauma-informed care and best professional practice in this context? Option A. Nurse should reassure the survivor that the examination is a routine procedure and that their emotional reactions are not a primary concern for the forensic investigation. Option B. The nurse should make assumptions about the survivor's emotional state based on their initial presentation and focus on documenting objective findings without extensive verbal interaction. Option C. The nurse should proceed with the examination as quickly as possible to secure all potential evidence, minimizing conversation to avoid causing further distress or influencing the survivor's narrative. Option D. The nurse should explain the necessity of the examination for evidence collection, offer the survivor choices regarding the order of certain procedures, and clearly communicate each step before it is performed, while remaining attuned to their verbal and nonverbal cues. The correct answer is D. The nurse should explain the necessity of the examination for evidence collection, offer the survivor choices regarding the order of certain procedures, and clearly communicate each step before it is performed, while remaining attuned to their verbal and nonverbal cues. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent vulnerability of individuals who have experienced trauma. Forensic nurses are often the first point of contact for survivors, and their interactions can significantly impact the individual's healing process and their willingness to engage with the legal system. The challenge lies in balancing the need for thorough data collection and documentation, which is critical for forensic evidence, with the imperative to create a safe and supportive environment that respects the survivor's autonomy and minimizes re-traumatization. Failure to do so can lead to a breakdown in trust, further distress for the survivor, and compromised investigative outcomes. Correct approach analysis. The correct approach prioritizes establishing trust and safety through a trauma-informed lens. This involves actively listening without judgment, offering choices and control where possible. E.g., regarding the pace of the examination, who is present, and clearly explaining each step of the process. This aligns with the ethical principles of beneficence and non-maleficence, aiming to do good and avoid harm. Regulatory frameworks for forensic nursing, such as those guiding practice in the U.S., emphasize patient-centered care and the importance of minimizing distress. A trauma-informed approach ensures that the forensic nurse recognizes the potential impact of past trauma on the survivor's current presentation and behavior, and adapts their communication and examination techniques accordingly. This fosters a collaborative relationship, increasing the likelihood of obtaining accurate information and supporting the survivor's recovery. Incorrect approach is analysis, an approach that focuses solely on the rapid collection of forensic evidence without acknowledging the survivor's emotional state or offering choices is ethically problematic. This can be seen as a violation of the principle of respect for persons and autonomy, potentially leading to re-traumatization. Such an approach fails to recognize the psychological impact of trauma, which can manifest as dissociation, hypervigilance, or difficulty with memory, all of which can be exacerbated by an insensitive examination. This approach also risks alienating the survivor, making them less likely to cooperate with further investigative processes or seek necessary support services. Another incorrect approach involves making assumptions about the survivor's experience or emotional response based on their presentation. Forensic nurses are trained to be objective, but this objectivity should not be confused with a lack of empathy or understanding. Projecting personal biases or making definitive statements about the survivor's feelings or motivations without their input can be deeply invalidating and harmful. This directly contradicts the core tenets of trauma-informed care, which emphasizes survivor strengths and resilience and avoids pathologizing their responses. A third incorrect approach would be to dismiss or minimize the survivor's expressed concerns or discomfort during the examination. While forensic examinations require a certain level of invasiveness, a trauma-informed practitioner will acknowledge and validate these feelings and explore ways to mitigate them within the constraints of the examination. Ignoring or brushing aside a survivor's distress signals a lack of respect for their experience and can lead to significant emotional harm, undermining the therapeutic alliance and the integrity of the forensic process. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive understanding of the survivor's potential trauma history and its impact. This involves active listening, open-ended questioning, and a commitment to providing choices and control. When faced with a situation requiring forensic examination, the professional should first assess the survivor's immediate safety and emotional state. They should then clearly explain the purpose and procedures of the examination, offering opportunities for the survivor to ask questions and express any concerns. Throughout the process, the professional must remain attuned to the survivor's verbal and nonverbal cues, adjusting their approach as needed to ensure comfort and minimize distress, while still meticulously documenting all findings relevant to the forensic investigation. This balanced approach upholds both ethical obligations and legal requirements. Question 19. The investigation demonstrates the presence of multiple potential types of forensic evidence at the scene, including visible bodily fluids, trace fibers adhering to clothing, and a distinct footwear impression in a soft substrate. A forensic nurse is tasked with the initial collection and preservation of this evidence. Which of the following approaches best ensures the integrity and admissibility of all collected evidence? Option A. Systematically photograph and document each type of evidence in situ. Collect biological samples using appropriate sterile swabs and air dry them before packaging. Collect trace evidence using specialized tools and place it in separate, breathable containers. And lift the footwear impression using appropriate casting materials, ensuring meticulous chain of custody documentation for all items. Option B. Prioritize the collection of visible bodily fluids. Photograph the footwear impression without attempting to lift it, and place all collected items into a single sealed plastic bag for transport. Option C. Collect only the visible bodily fluids, as these are the most direct indicators of the crime, and defer the collection of trace evidence and impressions to a later stage by a specialized unit. Option D. Package all collected evidence, including wet biological samples, in airtight plastic bags to prevent evaporation and contamination during transport to the laboratory. The correct answer is B. Prioritize the collection of visible bodily fluids, photograph the footwear impression without attempting to lift it, and place all collected items into a single, sealed plastic bag for transport. Explanation: this scenario is professionally challenging due to the critical need for accurate identification and preservation of diverse forensic evidence types, each requiring specific handling protocols to maintain admissibility in legal proceedings. The certified forensic nurse's role extends beyond direct patient care to encompass meticulous evidence collection and documentation, directly impacting the integrity of the investigation and the pursuit of justice. Adherence to established forensic protocols is paramount to prevent contamination, degradation, or loss of evidence, which could compromise the case. The correct approach represents best professional practice because it prioritizes the systematic and appropriate collection of all potentially relevant forensic evidence. This includes biological samples, e.g., semen, saliva, blood, trace evidence, e.g., fibers, hairs, and impression evidence, e.g., bite marks, footwear impression, ensuring that each is handled according to its specific requirements. This aligns with the principles of forensic science and the legal standards for evidence admissibility, such as chain of custody and proper preservation techniques, as mandated by relevant U.S. federal and state regulations governing forensic investigations and healthcare provider responsibilities in such contexts. An incorrect approach that focuses solely on visible injuries without considering less apparent biological or trace evidence fails to meet the comprehensive requirements of forensic evidence collection. This oversight can lead to the loss of crucial evidence that might establish perpetrator identity or link the victim to the crime scene. Ethically, it represents a failure to provide thorough and complete forensic services, potentially hindering the investigation and impacting victim advocacy. Legally, it could be challenged as negligent collection, leading to the exclusion of any evidence that was collected, thereby undermining the prosecution. Another incorrect approach that involves improper packaging or storage of biological samples, such as failing to air dry wet biological evidence before packaging, introduces a high risk of degradation and microbial growth. This compromises the integrity of DNA analysis, a cornerstone of modern forensic investigations. Regulatory frameworks, such as those outlined by the National Institute of Justice (NIJ) and state-specific forensic guidelines, strictly prohibit such practices to ensure the scientific validity of the evidence. Failure to adhere to these standards renders the evidence unreliable and inadmissible. A further incorrect approach that neglects to document the precise location and context of each piece of evidence collected, or fails to maintain a meticulous chain of custody, creates significant legal vulnerabilities. The chain of custody is a fundamental legal requirement to demonstrate that the evidence has not been tampered with or altered from the moment it was collected until it is presented in court. Violations of chain of custody protocols can lead to the exclusion of evidence, regardless of its potential probative value, and can result in a mistrial or acquittal. This directly contravenes established legal precedent and forensic best practices. The professional decision-making process for similar situations should involve a thorough understanding of the specific allegations and the types of evidence likely to be present. This requires a systematic approach, beginning with a comprehensive scene assessment or patient examination in a clinical forensic setting, followed by the identification of all potential evidence types. Each type of evidence must then be collected, packaged, and preserved according to established forensic protocols and relevant legal requirements. Meticulous documentation, including detailed notes, photographs, and sketches, is essential, as is the unwavering maintenance of the chain of custody. Continuous professional development and adherence to guidelines from reputable forensic organizations are crucial for ensuring competence and ethical practice. Question 20. Stakeholder feedback indicates that forensic nurses sometimes face challenges in balancing patient advocacy with their role in evidence collection for legal proceedings. When a patient presents for a forensic examination following a sexual assault, what is the most ethically and legally sound approach for the forensic nurse to take regarding informed consent and disclosure of information? Option A. Proceed with the forensic examination immediately to preserve evidence, assuming consent due to the nature of the incident, and inform the patient of the legal implications afterward. Option B. Conduct the forensic examination without explicitly detailing the legal implications of evidence collection, focusing solely on the medical aspects of care to avoid overwhelming the patient. Option C. Prioritize the collection of all potential evidence for the legal investigation, even if it means delaying immediate medical care or not fully explaining the legal ramifications to the patient. Option D. Obtain explicit informed consent from the patient for the forensic examination, clearly explaining the purpose of the examination, the procedures involved, and how the collected evidence will be documented, preserved, and potentially used in legal proceedings, while also addressing the patient's immediate medical and emotional needs. The correct answer is D. Obtain explicit informed consent from the patient for the forensic examination, clearly explaining the purpose of the examination, the procedures involved, and how the collected evidence will be documented, preserved, and potentially used in legal proceedings, while also addressing the patient's immediate medical and emotional needs. Explanation. This scenario presents a professional challenge due to the inherent tension between a forensic nurse's duty to the patient and their obligation to the legal system. The forensic nurse must navigate complex ethical considerations, including patient confidentiality, informed consent, and the potential for the collected evidence to be used in legal proceedings. The nurse's actions directly impact the patient's well-being and the integrity of the legal investigation. Careful judgment is required to balance these competing demands, while adhering to professional standards and legal mandates. The correct approach represents best professional practice because it prioritizes the patient's autonomy and well-being, while ensuring that all actions are legally sound and ethically defensible. Obtaining informed consent for the forensic examination, clearly explaining the purpose of the examination, and detailing how the collected evidence will be handled and potentially used in legal proceedings upholds the patient's right to self-determination and transparency. This aligns with the ethical principles of beneficence, non-maleficence, and justice, as well as legal requirements for evidence collection and preservation. An incorrect approach that fails to obtain informed consent before the forensic examination is ethically unacceptable because it violates the patient's right to autonomy and bodily integrity. This constitutes a breach of professional ethics and potentially legal battery. Another incorrect approach that withholds information about the potential legal implications of the forensic examination from the patient is ethically problematic, as it undermines informed consent and creates a false sense of security for the patient, potentially leading to later distress or legal complications. This also fails to uphold the principle of veracity. A third incorrect approach that prioritizes the needs of the legal system over the immediate medical and emotional needs of the patient, without proper justification or consent, is ethically unsound. While forensic nurses have a role in the legal system, their primary duty of care remains with the patient, and this duty cannot be abdicated without due process and ethical consideration. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's immediate medical and emotional needs. This is followed by a clear and comprehensive explanation of the forensic examination process, including its purpose, procedures, and potential legal ramifications, ensuring the patient understands their rights and options. Obtaining explicit, informed consent is paramount. Throughout the process, maintaining patient confidentiality, respecting their dignity, and advocating for their best interests should guide all actions. If there are conflicts between patient care and legal requirements, the forensic nurse should consult with legal counsel or appropriate supervisory bodies to ensure ethical and legal compliance.